Good afternoon and welcome to the August 18th press conference here in Seminole County. We're here to talk about quite a few things today. We appreciate the school board opening up their facility, and of course Walt Griffin, who is going to be the man of the hour, will be here to tell us everything about the grand opening of the schools and the great job that they're doing on behalf of the community. And so I just want to take a moment and thank Dr. Griffin for the fine job that you and your staff have been doing. I know that you've been working since when school was supposed to be out and wasn't out, and when you were doing virtual, and now getting things geared back up to give our families so many choices. It speaks volumes of the school board as well as our community. I also want to take a moment and thank all of our people and our businesses, as well as our residents who remain vigilant in helping mitigate the spread of COVID-19. We want to thank the hospitals and all those frontline workers in the hospitals who continue to help our community and treat those patients that unfortunately contract this unfortunate virus. We want to thank the first responders, our fire department, our EMS people who are constantly responding to the needs of our community, as well as our law enforcement. We're here today on behalf of the County Commission, as well as the 7 cities. We're going to roll out our CARES program, which we've been talking about for the last couple press conferences. We're going to give you some more details today. So as you know, we've been allocated $82 million to Seminole CARES in our funding program. This is meant to address all the consequences related to the COVID-19 impact. The Seminole County Board of County Commissioners has approved the Seminole CARES, a comprehensive relief package that is designed to support county businesses, residents, and not-for-profits and local government entities. So this money will be shared with the 7 cities, as well as people who have a personal need or a family need, as well as the small business community. The County Commission has allocated $10 million towards the Seminole CARES small business grants, $7 million towards the Seminole CARES individual grants, and up to $3 million towards the Seminole CARES not-for-profit grants. Tomorrow at 10 a.m., the portal officially opens for the small business grants. Visit SeminoleCares.com to find that portal. Again, that's SeminoleCares.com. There you will find all the information you need to get prepared to put your application in process. You've heard us talk previously. Hopefully you've taken the cue to gather those documents that were previously put out as a precursor to help you get your stuff ahead of time. We know a lot of people need this. The home-based and mobile businesses or commercially zoned business with up to 1 W-2 employee will be entitled up to $5,000. Commercially zoned businesses with 2 to 25 employees will be eligible up to $10,000. Commercially zoned businesses with employee counts of 26 to 50 are eligible up to $15,000 of grant money. These one-time funds are available on a first-come, first-served basis. It can be used for rent or mortgage. It can be used for payroll, utility costs for the business location, investments to meet reopening guidelines such as PPE equipment and other workplace improvements directly related to mitigating the spread of COVID-19. Remote access equipment such as computers, software, and printers for employees to enable telecommuting to allow for social distancing will also be considered. Internet-based communications and service delivery technology that helps directly address customers and or employees in response to the new work schedules and service and product delivery. We strongly encourage all business owners to ensure they are prepared to submit complete applications with all 5 supporting documents. The list of required documents, again, is at SeminoleCares.com. This Thursday on the Seminole County Facebook page, staff will host a live chat to help applicants with both the business applications at noon and individual grants at 12:30. So make sure you tune into the Seminole County Facebook page for additional information. In addition, tomorrow's support hotlines will be made available. If we write these numbers down, the small business support line will be 877-298-3539. Individual support, this is for those private citizens or families who are in need. That phone number is 877-330-1818. Again, that's 877-330-1818. These are the numbers that you need to call for any questions that you have or any information you may need to know about this CARES Act money. The portal for individual or household grants will open next week on Wednesday, August 26th. So if you have a personal need or something in the way of a family need, then your portal will open on the 26th. Frequently asked questions, required document checklists are also available in Spanish on the website. We cannot stress enough the importance of preparing ahead of time, and all these funds are on a first-come, first-served basis. Moving on to updates, joining us today is Emergency Manager Alan Harris to provide a general update on the county response to the virus, as well as Mr. Harris will be followed by Seminole County Public Schools Dr. Walt Griffin, who will give us a recap on the reopening of the schools. We also have the Department of Health, Seminole County's Health Officer, Donna Walsh. With that being said, Mr. Harris.
Good afternoon. Thank you, Chairman. I'm happy to report mostly good numbers today related to COVID-19 and our response. The only bad number that we have to report is the number of fatalities in Seminole County. While Seminole County has experienced hundreds of fatalities from individuals who had COVID-19, the confirmed death due to only COVID-19 is 152, which is an increase. There are numerous conspiracy theories related to COVID-19 fatalities, so I'd like to go over those. To dispel one of the rumors, it is important to know the facts. Just because someone has COVID-19 when they die, that does not mean they have died because of COVID-19. Let me stress again, the number of COVID-19 fatalities is 152, but many others have passed from other causes while they happen to have COVID-19. There are conspiracy theories on both sides of the pandemic. It's important to get information from trusted sources and not social media comments, especially when you do not know the person commenting on whatever social media platform you use. Comments related to government hiding deaths or inflating numbers is simply fake news. The total number, again, of COVID fatalities for Seminole County is 152. On June 29th, Seminole County issued an executive order requiring social distancing, the wearing of facial coverings and masks. At that time, Seminole County was experiencing around 150 to 200 new cases per day. Approximately 2 weeks later, which is the incubation period, of course, of COVID-19, the daily count has dropped and continues to drop, now at a level of 30 to 50 cases per day, which is a 60% decrease in daily new cases, as you can see here on the slide, or on the poster here. At the same time, hospitalizations have gone down. Hospitalizations went from 200 to 230, now down to the low 80s, and it continues to decrease, a 55% decrease in hospitalizations. The current positive cases isolated and quarantined in their homes has decreased from over 3,000 to now just above 1,000, a 65% decrease in Seminole County of current cases. The positivity rate of testing has decreased. Over the last month, it's gone from 13% now to a weekly average of 5 to 7%. These numbers mean that Seminole County is simply a safer place than we were a month ago. We are very optimistic about these numbers, and we hope that they will continue to drop. If safety measures remain in effect, we should continue to move in the right direction and see these numbers continue to decrease. As these numbers continue to decrease, our hope is the economy will continue to rebound. To date, it is very important that we stress there are no major outbreaks. There have been no major outbreaks in any gyms, fitness centers, or retail establishments in Seminole County. That's fantastic. That means that it is safe to go to Seminole County businesses. It is safe to work out in Seminole County gyms, and we encourage people to do so using the proper safety precautions. The reason that we say this is because they have excellent safety measures, and those safety measures have been taken on by our business community, and we really appreciate that. Speaking of safety measures, the Seminole County Public Schools has put in hundreds of hours in planning, installing safety equipment to make it as safe as possible for children to go to school. Here to speak about the first week of school is Dr. Griffin, the Superintendent for Seminole County Public Schools. Dr. Griffin.
Thank you, Mr. Harris, and thank you, Chair Zembower. Today's our second day of school, and we had an outstanding opening yesterday. It exceeded all of my expectations. We were prepared for every possible scenario that you can imagine, and because of the diligence and hard work of our teachers, our administrators, and our families, yesterday ran very similar to any other first day of school. Our transportation system was on schedule. Over 330 buses ran 6 routes. And we had a few minute delays here and there. Remember yesterday at dismissal, of course, I think this happens every year, we had a storm, so put the afternoon buses a little bit behind schedule, but overall, all 330 buses did a great job getting our students back and forth the first day. We also celebrated yesterday the grand opening of the Pinecrest School of Innovation. Pinecrest School of Innovation is a 900-student magnet school with all the latest and greatest technology and learning tools for 21st century learners. Very, very proud of this $26 million investment in our community, and certainly for the students at Pinecrest and the families who choose Pinecrest as their school. As far as numbers yesterday, as all of you know, we've offered 4 choices to our families: face-to-face, Seminole Connect, which is our remote option, Seminole County Virtual School, which is a decade-old program that continues to be very popular, or a hybrid, which is a combination of the first 3 that were mentioned. 44%, or 28,000 of our students attended face-to-face yesterday. They all wore their mask. The day went very, very well with their teachers, in their classrooms, with their mask on, in rooms that have been sanitized and disinfected for their safety. 25,000 of our students connected yesterday. Very pleased to say that we did not have district-wide bandwidth issues. I know there have been some outages due to internet outages, around the county. That happens every single day someplace. But overall, our bandwidth did very, very well. Our students connected, and it worked out. Probably our greatest challenge is Seminole County Virtual School. We moved from about 1,000 students last year to 12,000 students this year. So we still have a few more days to get all the kinks worked out for Seminole County Virtual School. We're asking parents to be patient. Please check their child's email, not theirs, because that's where the links are being sent for the children to make sure they have their courses and their coursework. But the 500 teachers that we moved over to Seminole County Virtual School have all been trained and all anxious to receive our students. A few things that we purchased that a community may not know. We purchased hospital-grade misters for each of our schools. We liked them so much, we've ordered additional misters, and at the end of each day, each classroom that has students in it will be misted so that it is ready for the next day. In addition, throughout the day, there'll be deep cleaning done on touch points and things like that throughout the school. We also purchased 25,000 desk shields. Desk shields are simply 3-sided piece of cardboard and plexiglass that prevent students from spreading respiratory droplets from each other. But that, in addition to our masks, we believe really protects our students and our teachers. The desk shields were really, really put together to help our teachers when they're working with small groups, when students are doing cooperative learning. It's just another barrier or another shield for safety. Probably the greatest challenge that we're having, surprisingly, over the past 2 days, I've had many, many requests of parents who've selected remote or Seminole Connect or Seminole County Virtual program and now want their children to go face-to-face. So my message to those families is going to be on a space-available basis, school by school. We do have some space available at some of the schools and some of the classes, but you need to work directly with the school if you're interested in making that conversion. But overall, working with the Seminole County Health Department, our medical officials, continuing to follow their guidance. Seminole County has had a great first day. Second day is almost concluded. And again, I cannot thank our teachers, our administrators, and our families enough for all the work that they've done to make the first 2 days go so smoothly. So at this time, it's my honor to introduce the Seminole County Health Department, Seminole County Public Schools' good friend, Donna Walsh.
Good afternoon, and thank you, Dr. Griffin. Just to review some of the data that Mr. Harris reported out. In the state of Florida, we have reported 579,932 cases to date, with 9,758 deaths overall in our entire state. The overall positivity rate for the state is 13.53%. However, the state as a whole has seen improvements as well in the daily positivity rates, with less than 10% daily positivity rates in the last 6 days. In Seminole County, as was mentioned, we have seen significant improvements, as was pointed out by Mr. Harris. Certainly a contributing factor is the adherence to all of the precautions that have been messaged since the beginning of this response, in particular the use of a mask in our community. We certainly have seen a marked improvement. So out of the 7,530 total cases reported here in Seminole County, we have 1,114 current active cases. We have, as was mentioned, 83 current hospitalizations out of the 518 total hospitalizations over the course of this response. We have additionally seen a marked decrease in daily positivity rates overall in Seminole, 10.5% positivity rate, but on a daily basis, we have seen in the last week a 5.56% positivity rate. In the last 2 weeks, 5.77% positivity rate. So it's very encouraging. In the last 14 days, less than 7% daily positivity rates in our county. Significant signs that we are improving in the transmission of this infection in our communities. We are certainly promoting vigilance, though, as we continue to congregate and to gather together. We need to continue to take those precautions of the hand washing, the facial coverings, and the social distancing. All of those things have been very important in continuing to keep this from spreading. There's a lot of interest in the cases in our pediatric population, and I believe I mentioned last week that in the state of Florida, the reported cases for children less than 18 years of age is a total of over 46,000. And then, as far as in the last 2 weeks, from August 4th through the 17th, the state has reported 7,618 cases alone, with 78 hospitalizations. There have been a total in Florida of 7 pediatric deaths, 1 in the 5 to 10-year-old range, 2 in the 11 to 13-year-old range, and 4 in the 14 to 17-year-old range. I'm very happy to report in Seminole County we have not had any reports of pediatric deaths to date. There's also, as many of you are probably aware through coverage in the media, that the multi-system inflammatory syndrome that's been identified nationwide as well as globally. In the state of Florida, there's been 33 such cases reported in pediatric children, 7 cases in the 0 to 4-year-old age group, 21 in 5 to 14, 4 in 15 to 18, and 1 in a 20-year-old. So hence the importance of continuing to stay vigilant, no doubt. In Seminole County, to bring it home, as of August 10th, we've had a total of 527 pediatric cases reported to us here, and in the last couple weeks, the 4th through the 17th of August, 79 cases in our pediatric population. Some of those cases have been hospitalized, more so in the 15 to 24-year-old age group. So the testing continues through the month of August. The Seminole County Health Department will continue to provide testing by appointment Tuesday through Thursday from 9 a.m. to 1 p.m. Our partners, True Health, are also providing testing, no appointment necessary, at their Castleberry and Airport Boulevard locations. And then there's certainly testing available through other partners such as Allied Health. In the month of August, I know that we have a visit from our incident management team in Tallahassee this week at Eastmont, and also Harvest Time International, that if you go to prepareseminole.org, you'll see more information on both of those test sites. The health department stands ready, and we're fully prepared to respond to reports of any suspect or confirmed cases in students, faculty, and staff in our school settings. We have been with the school board and Dr. Griffin and his team all along through the planning process, through the task force and work group meetings, to assure that they have all the resources and information that they need in order to prepare to keep their campuses safe for their students, faculty, and staff. as well as outside the campus, right? The bus drivers and, all of the elements and factors that are involved to making sure everyone who's part of the school family remains safe and healthy throughout. So we have designated a team at the health department through our epidemiology program. We certainly will make this a priority if we do receive a phone call that there is either a suspect, somebody who's symptomatic, or somebody who is a confirmed positive. We react immediately. And in fact, our state health office has made testing available, very quick testing through our Bureau of Public Health laboratories. So in the event that we need to get a quick test done of any students in classrooms or faculty, staff, we can do that very readily so that we make sure that we get folks who are tested, if they test positive, to medical care as soon as they need it, and also prevent the infection from spreading in those settings. So it's very important, as I mentioned before, that we continue to follow those precautions that was mentioned, the facial coverings, hand washing, and social distancing. They have been effective throughout this response and will continue to be effective until a safe vaccine is developed, and that may be, a while, maybe months to come. Research is still out. There's certainly many clinical trials in process, and there is some encouraging outcomes so far, but nothing definitive yet as to when a vaccine might be available for our community. So I would refer you to prepareseminole.org and also floridahealthcovid19.gov for further information on any of the data, as well as any resources available for testing. The Seminole County Citizens Information Hotline remains open for anyone with questions Monday through Friday, 8 a.m. to 5 p.m. at 407-665-0000. Thank you so much. Chairman.
Thank you, Donna. And so this is why Seminole County is such a great county to live in. You see all departments, all cities, county united, working together for the benefit of an entire community. It really is a fantastic place. When we see things that are happening around this country and what you see going on in this county, we can only be proud. So with that, we'll take questions from the media that's here today for anyone. Yeah, so I think it's, well, as far as status quo, I mean, I don't think there's any doubt. I mean, we know when we start moving around more and now the schools are open, we are not, and nor do we have any misconception that there's going to be somebody that tests positive. I think the school board has a very good plan with our health department, working with the state and all of our partners, to identify those so it does not become a, quote, crisis. As far as should we let our guard down? No. We have begun to reverse what we saw happening earlier. This depicts it very clearly. This does not mean it's over. It does not mean that we go back to not wearing masks and not washing our hands and not social distancing. It's a small price to pay. I mean, a lot of us want this to be over as quick as possible. It's just simply not going to happen. But it's going to happen quicker if we do what the health experts have told us, which is wear a mask when you can't social distance, make sure that you wash your hands frequently, don't touch your face when you don't have to, and of course keep 6 feet apart. Avoid large crowds and all the other things that we all know that's been happening, but this is absolutely no time to think that we can let our guard down and go back to, the way things used to be. Yes. Dr. Griffin?
The question is about bus safety. Well, first of all, we only have 28,000 of our 67,000 students attending school, and we're only transporting about half of those students, yet we're still running the same number of buses. So we have a much less dense population on buses. So our students are spread out as much as practical, but we are requiring the use of masks on the buses because we can't socially distance in every single situation. The bus drivers also have to wear a mask, and we also provided shields if they want those in addition to the mask. Some drivers have asked while they're actually driving, if they wear glasses, their glasses fog up, so they will pull down their mask and just keep your shield down while they are driving, not in direct contact with the students. The question is about student safety when working remotely through our platform. And all of our curriculum is loaded on our platform, so our students are accessing it from us. That does not eliminate the danger of what a child can do on the internet on their own, and that's why it's so important for parents to supervise, check their history, see where the students have been. When they are working in our curriculum, they're working through our platform. But when they're not, they have to be supervised just like any other time at home. I think it is. I think it's a combination of things. I really think in some families' hearts, they didn't think we were going to be able to open face-to-face, and they were just uncomfortable, didn't have enough information. And that's why we pushed the date back as late as we could for families to make decisions. By doing that, I created a real scheduling challenging for our schools. But I think students are giving their parents some pressure. They heard about their buddies going to school. They saw all the news yesterday, all the excitement of the first day. And I think some of those students really just want to get back to school, and their parents now are in support of that. So we will accommodate who we can. School-by-school basis. Yes, we had, before the students arrived, we had a teacher who was not feeling well last week. The colleague that she was working with and herself are quarantined until we've received test results. Not that I'm aware of. Repeat the question, Dave? You don't know how to feel. No, I don't. No. Yeah, the question is, have any students reported to the COVID clinic or the COVID area? Not to my knowledge. I received a report for yesterday. I have not received it for today yet, but I will at the end of the school day. The question is, if we had to close the schools for face-to-face instruction, could we go remotely? And the answer is yes. It would take us a little while. We did it fourth quarter. I can tell you that our curriculum and our platform is much improved from fourth quarter. We worked on it from March all the way through now, so we could pivot if we had to pivot.
Well, the positivity, the positive cases are honestly all age groups. You know, we are seeing, when we first started to see the surge again in the number of positive cases, we were seeing that in the 20 and 30-year-old somethings. It's now in like the 25 to 34-year-old age group. But certainly it's not restricted to any one age group over another. We are seeing that people in more congregate settings, such as nursing homes and such, that tend to be more likely to be exposed and test positive. But honestly, it's across the board. We're seeing a nice curve with the age groups that are being affected. But right now, it's still in that 20, 30-year-old. That's where the majority of cases are occurring and where people congregate. Sure, it's a really good question. Question was whether or not when we do our case investigations, are we discovering that people are wearing masks or not? It's a variety. You know, some folks will wear masks, but perhaps they don't wear them all the time when they're around someone less than 6 feet apart. So that's what we're finding, is there's extended exposure to somebody. It's, you know, just out and about, you know, meeting with friends and such, and they're not wearing the mask when they're in close proximity. So this is effective. It's not 100%, but it certainly reduces the chances of spreading the infection.
Well, again, we appreciate the media being here today to get the message out to our community, especially on behalf of the school system. Again, I want to thank everybody for being here, as well as our staff who spend hours and hours and hours. I forget what day we're in. I think it's day 160-something of an emergency situation. So I want to take a moment and just thank them again for being there on the front line each and every day to make sure that our community stays safe. With that said, we're going to have Mr. Freddie Gonzalez, who is now going to do the Spanish translation. Freddie, thank you for doing this for us.
Buenas tardes, este va a ser el resumen en español de la conferencia de prensa hoy, el 18 de agosto del 2020. Primero empezó hablando el presidente de la Junta de Comisionados del Condado, Zembower. Empezó mencionando del dinero que el Condado de Seminole recibió del Estado de la Florida, de $82 millones del fondo de CARES, que va a ser dedicado completamente a ayudando a mejorar la economía que fue afectado estos últimos meses por la pandemia del COVID-19. Él mencionó como la Junta de Comisionados del Condado aprobó un paquete de alivio para ayudar a los negocios, residentes y organizaciones sin fines de lucro que fueron afectados durante estos meses. Este Seminole CARES está 100% dedicado para ayudar solo todo lo que fueron afectados de esta pandemia del COVID-19. Él mencionó otra vez, como fue mencionado antes, que ha dedicado $10 millones para el fondo para los negocios pequeños, a la misma vez 7 millones para los residentes del condado y 3 millones para las organizaciones sin fines de lucros. Mencionó que mañana a las 10 de la mañana va a abrir el portal por nuestra página de web dedicado para el programa de los negocios pequeños, de los fondos, cómo pueden aplicar y cómo pueden ganar más información de ese programa. Pueden ir a nuestra página de web, que es nuevo, el seminolecares.com, y ahí va a estar abierto otra vez mañana a las 10 de la mañana. Otra vez se fue mencionado que si tenés un negocio de la casa o de móvil, o tenés un empleado, pueden cualificar hasta $5,000 del dinero. A la misma vez, los negocios que tienen de 2 a 25 empleados pueden recibir hasta $10,000. Y también tiene de 26 a 50 empleados, pueden recibir hasta $15,000. Esto es un fondo de una vez y es por orden de llegada. Es basado más para ayudar a los negocios con su hipoteca o alquiler, también para costos de utilidad, también cualquier costo que tenía que hacer en estos meses para proteger negocio de la pandemia, como protección personal para los empleados y para también las personas que van de compran ahí. Estamos asegurando que los dueños de estos negocios tengan toda la información, los 5 diferentes documentarios que es necesario y que se requiere para aplicar para este programa. Pueden buscar más información y tener toda la información del programa en seminolecares.com. Y en este jueves también se mencionó que vamos a tener un Facebook Live en nuestra página, que va a estar hablando a las 12 de la tarde cómo se aplica y cómo es el programa para los negocios de los fondos, y a las 2:30 de la tarde va a hablar de cómo pueden aplicar y la información para el fondo para los residentes que fueron afectados también. Empezando mañana va a haber una línea de teléfono que pueden llamar a cómo pueden aplicar, tener más información o que te pueden ayudar. La primera línea del teléfono va a ser dedicado solo para las preguntas y cualquier cosa que necesitan en el tema de los fondos para los negocios pequeños. El número es 877-298-3539 y el segundo número es para el programa para los residentes que fueron afectados también. Ese número va a ser 877-330-1818. Y hablando del programa de los residentes que fueron afectados, el portal va a abrir la semana que viene, el miércoles 26 de agosto. Ahí también vamos a tener disponible en nuestra página de web cualquier documentario o pregunta que tengan. Va a estar todo disponible en español para ayudar a esos que entienden mejor el español. Estamos anticipando que pueden seguir ganando más información y que preparen sus documentarios más pronto posible, porque acuérdense que es por orden de llegada. El primero que llega va a ser el primero que va a recibir. Siguiente vino el director manejo de emergencias, Alan Harris. Él vino mencionando que la mayoría de los números tratando del COVID-19 fueron buenas noticias. Lo único es, hay un número que fuera de malas noticias y fue el número de fallecimientos. Durante este tiempo había un total de 152 fallecidos por el COVID-19. Desafortunadamente también vemos que hay muchos que no entienden la diferencia entre los fallecidos del COVID-19 y lo que fueron fallecidos estos últimos meses que no se trató del COVID-19, significando que los 152 que fallecieron estos últimos meses fueron por el tema del COVID-19, no fue por otro tema. Mencionó también desde que el 29 de junio que el condado de Seminole puso una orden ejecutiva pidiendo que tenga distancia social y usar mascarilla. Los números de en ese momento había recibido al día 150 a 200 nuevos casos. Y a la misma vez, 2 a 3 semanas después de esa orden que fue, estamos recibiendo de 30 a 50 nuevos casos, que eso fue que ha bajado un 60% de los casos diarios. A la misma vez, en esa época también teníamos 200 a 230 personas hospitalizados, pero en este momento tenemos entre los 80, que ha bajado un 55%. También teníamos casos positivos en el momento, un poquito más de 3,000 personas a la misma vez. Pero ahora en este tiempo tenemos un poquito más de 1,000 personas y eso fue un bajado de 65%. La tasa de positividad en el momento era un 13%, pero ahora en esta semana vemos que es un 5 a 7%. Eso significa que el condado de Seminole está más seguro que lo que estaba hace un mes atrás y estamos positivos que si seguimos al camino que estamos, vamos a seguir bajando los números y vas a estar más seguro en este condado. También vino el superintendente de las escuelas públicas del condado de Seminole, el doctor Walt Griffin. Mencionó ayer que fue el primer día de las escuelas que empezaron, que fue muy bien y no había muchas complicaciones. También mencionó que había un total de 330 autobuses con 6 diferentes rutas que fueron sin problema y no había ninguna situación que salió. También mencionó ayer que fue el primer día de la nueva escuela, High Press, que fue mencionado, que empezó ayer y es nuevamente abierta ayer para su primer año. Él mencionó que el condado de Seminole le dio a los padres 4 diferentes opciones para los estudiantes que pueden estudiar este año. Mencionó que ayer había 28,000 estudiantes que están aprendiendo en la escuela en persona cara a cara. Después mencionó que había 25,000 estudiantes que están haciéndolo por el Internet. Y a la misma vez el programa de Virtual aumentó de 1,000 estudiantes el año pasado a 12,000 estudiantes este año. Y ahora tiene más de 500 maestros que también están en la escuela Virtual. Ordenaron más de 25,000 protecciones para los escritorios en todas las escuelas del condado para tener los estudiantes con más protección en ese momento. También se dan cuenta que hay muchos padres pidiendo a la escuela que tienen los estudiantes estudiando de su casa que si puede empezar a estudiar de la escuela. Eso basado por cada escuela dependiendo del espacio que tienen y lo que se requiere en cada escuela. Y finalmente habló la directora del Departamento de Salud, Donna Walsh, que empezó hablando que en el estado de la Florida, en un total, tenemos 579,932 casos positivos y con 9,758 fallecidos. En el condado de Seminole, en total, hay 7,530 casos confirmados, pero en este momento activos hay 1,114 casos activos. En total teníamos 518 hospitalizados y en este momento activo tenemos 83 hospitalizados. La tasa de positividad en total desde que empezó en marzo es un 10.51%, pero en esta semana vemos que ha bajado a un 4.97%. Vemos que en estas últimas semanas, la semana pasada también tenía una tasa de positividad de un 5.56%. Vemos con las semanas que pasan, sigue bajando la tasa de positividad y los casos también. Es muy importante que sigamos usando la mascarilla, lavándose las manos y teniendo la distancia social que podemos en cada momento. El Departamento de Salud está trabajando con la escuela y tiene un equipo preparado para cualquier momento que vea un estudiante, un empleado o maestro o maestra que puede estar enfermo o no se siente bien. Ya tiene el plan preparado para cualquier momento, pueden ir a hacer la limpieza necesaria y hacer lo que tienen para tener la seguridad de los estudiantes y los empleados en todo el tiempo. Finalmente, también mencionó que siguen los sitios de prueba en el lugar que ellos están en el Departamento de Salud los martes, miércoles y jueves todas las semanas tienen de 9 de la mañana a la 1 de la tarde. Y hay diferentes lugares de pruebas de salud que se puede conseguir en prepareseminole.org. Si ustedes tienen cualquier otra pregunta, necesitan más información de los diferentes fondos del COVID-19 o preguntas de las escuelas, pueden ir al prepareseminole.org o llamar nuestra línea de información al 407-665-0000. Eso siempre va a estar disponible de lunes a viernes de 8 de la mañana hasta las 5 de la tarde. Muchas gracias.